Good morning, students. Welcome to the session on Introduction to Cohort Studies. These are the learning outcomes. At the end of the session, the students would be able to define cohort study, list the types of cohort study, and briefly explain the framework of cohort study. Cohort studies are analytical epidemiological studies done to test the causal hypothesis. It is an observational study. Now we can go through what is meant by cohort. Cohort is a group of individuals who share a common characteristics or experience within a defined time period. Some examples of cohorts: all those who were born in 1998 form the birth cohort of 1998. Okay, all those students from QIU form the medical student cohort of Quest International University. All those who are exposed to a common drug or vaccine or a risk factor within a defined period of time is known as an exposure cohort. A group of males or females who were married on the same day or same year or same period of time is known as a marriage cohort. Okay, so you may have understood what is meant by a cohort. They share the same characteristics during a same period of time. Students, two groups of individuals are there in a cohort study. One is known as study cohort or exposure cohort, those who are exposed to a risk factor. Another is the control cohort or comparison cohort, those who are not exposed to the risk factor. They form the basis of the cohort study. Incidence of disease among the exposed group or study cohort and the incidence of disease among non-exposed group or control cohort can be calculated. Then relative risk or risk ratio is calculated. That's the main calculation in cohort study. Attributable risk can also be calculated. How much of the outcome can be attributed to the exposure? Okay, this is a framework of a cohort study. Group of interest: smokers and comparison group, non-smokers. Make sure that both smokers and non-smokers or both uh, exposure cohort and control cohort are free from the outcome at the beginning of the study. Then they are followed up over a period of time. Then look for development of outcome or disease in the exposure cohort and control. Then compare the outcome. Cohort studies are longitudinal studies or follow-up studies or incident study. Okay, there are two types of cohort studies: prospective cohort study and a retrospective cohort study. Now we can go through what is meant by prospective cohort study. Okay, prospective cohort study is a forward moving study. Okay, if you are planning a research now and you are selecting the individuals, exposed individuals and non-exposed individuals, and make sure that they are not having outcome at this point of time. Then you follow up for a period of time in future. Maybe for next 5 years, you are following up exposure cohort and a control cohort. Then observe how many of the exposure cohort are developing disease, how many of the exposure cohort are not developing disease, how many of the control cohort are developing disease, how many of the control cohort are not developing disease. The researcher follows up the data from present longitudinally forward for a period of time and observes disease outcome, otherwise known as incidence of disease, in future among exposed and non-exposed individuals. Okay, now we can go through a classical example of prospective cohort study. Framingham Heart Study is a good example of prospective cohort study. Okay, it was started in 1948. This study is still going on. The Framingham Heart Study was undertaken to determine common contributing factors to cardiovascular disease. Development of cardiovascular disease in different groups exposed to various risk factors were observed, and they were compared with those without exposure to that risk factor. There were so many risk factors like smoking, alcohol use, lack of exercise, stress, so many risk factors. And they were observed for a period of time. Framingham risk score based on Framingham heart study can predict 10 years cardiovascular risk in an individual with no known cardiovascular disease. You can go to Google and look for Framingham risk score. You give all your information, it will tell you how much is the percentage of development, how much is the chance of development of cardiovascular risk, cardiovascular outcome in you in the following 10 years period. Okay, that is a classical example of prospective cohort study. Now we can go through retrospective cohort study. The retrospective cohort study is done backward. The researcher is standing today and collecting data from backward. Maybe 20 years back, they collect the data, how many are exposed to a risk factor and how many are not exposed to a risk factor. And uh, observe how many of those exposed to that risk factor developed the disease actually. How many of those not exposed to risk factor developed the disease actually in the past. That is a framework of a retrospective cohort study. The researcher follows up the data from past to present and observes disease outcome among exposed and non-exposed groups from the past. Okay, hope you understood. Now we can go through a classical example of retrospective cohort study. A study done by Case et al. In 1954 to examine the excess risk of bladder cancer among men who worked in a manufacturing plant of certain dyes. Researchers first made a list of men who worked in a chemical plant manufacturing dye in UK at least 6 months. Okay, who worked in that company for at least 6 months since 1920. The investigators searched retrospectively for the cases of bladder cancer among those men who had been employed in dye manufacturing industry between 1921 to February 1952. Number of cases of bladder cancer among those workers was then compared with the number of bladder cancer incidents in the general population to determine the excess risk of bladder cancer in men exposed to dye industry. Now we can summarize. Cohort study starts from individuals who are exposed or not exposed to a risk factor. Cohort study proceeds from cause to effect or from risk factor to disease. It is in contrast to case control study, which proceeds from disease to the risk factor backwards. So case control study is a retrospective study. Cohort study is a prospective study because it starts from cause and moves towards effect. Cause from risk factor and moves towards development of disease. Both the groups are examined periodically for the development of disease in question. Cohort studies are longitudinal studies or follow-up studies or incident studies. Thank you.